my name is Letitia Knighton, and today I'm going to be mixing insulin and doing a Z-Track administration. First thing about mixing insulin, before I pull my insulin, I'm going to check the MAR and make sure I get the right insulin. So for this demonstration, I'm using NPH and I'm using regular insulin. I also check the expiration of it. It's 02-2029. This is a 10 milliliter multi-dose new vial, and this is also regular 02-2029 10 milliliter multi-dose new vial. I will label them because they are new and put a date on it so it lets them know when it was open. I will gather my other supplies that's needed, my needle, which would be this is a 0.5 milliliter 28 gauge by 1/2 inch needle, insulin needle. And then for my Z-Track, I'm going to just pretend I got a different bottle here for the Z-Track. Check the expiration on it. It's a multi-dose vial as well. It's new and it's 02-2029. And this is a medication here, not insulin, something different, because insulin is always, done in an insulin with an insulin syringe. And for the needle for my Z-Track medication, I'm going to use a 22 gauge by 1.5 needle because I have a very large patient, and I want to make sure I get that needle into that muscle, past a lot of the fatty tissue. And I have the expiration date here is 10/18/2024. So both of my needles are good, expiration good. Now I've done 2 checks, one before I pulled it out, one after I pulled it out with the mark, and now I'm going to do my final check at the patient's bedside. Once I enter the room, gather all my supplies, I introduce myself, I wash my hands, and I explain to the patient what I'm about to do. And before I do so, I go ahead and ask the patient their name and date of birth. I go ahead and pull my curtain, and I apply gloves. The next thing I'm going to do, once they gave me the name and date of birth also, I checked it with the name band as well as with the name band against the MAR. So I do have the right patient, I do have the right drugs, I do have the right doses, I do have the right routes, I have the right time, and I have the right documentation. So right dose, amount, route, time, documentation, and patient. Alright, and next, I'm going to go ahead and mix my insulin. I have the NPH, which is the cloudy, and the regular, which is the clear. I'm going to take after I wash it, I've done everything I need to do. I'm going to take my needle, put it on a clean surface. I have a clean surface here. After I've opened it, I'm going to open it, making sure, do it in a safe way. My needle. I'm going to take both of my vials, open them, and wipe them off with the antimicrobial wipe. That's new. Let it dry. After it's dried, I'm going to go ahead and insert my air into my NPH cloudy vial. Sorry, I wanted to do that. So I'm going to put 10 milliliters. This patient, after doing a blood glucose check, they needed 10 units of the NPH. I verified that with the MAR. It is 10 units. So I'll direct my air in. And I'm going to do 10 units of the regular according to the MAR as well. So I'm going to pull back on the knob. And inject my 10 milliliters. Now what I'm going to do is invert this and go ahead and pull my clear. So being careful not to touch. I go ahead and inject the air. Now I'm going to pull 10 milliliters. Okay, I have 10 milliliters after inverting the bottle of the clear of the regular insulin. And I verify that with another healthcare professional. And now I'm going to pull 10 of the NPH. So I should have a total of 20. Holding the knob, being careful not to touch the inside of the plunger. I go down to 20. I have 20. And now I'm letting the the other nurse verify this as well. And that is according to facility policy, and most do require verification. So now I have mixed my insulin. I have 20 units, 10 of the clear and 10 of the regular, 10 of the NPH. After I administer it to my patient, subcut, I'm going to discard of the needle. Since it has a safety gauge on this one, I'm going to place the safety gauge and put it into the puncture-proof receptacle. And since I'm going to cleanse my insulins again on the top with the antimicrobial and close them up and dispose them into the proper storage area. And now I'm going to get ready for my Z-Track medication. So, with the Z-Track, I have a Z-Track medication here. I open it. I wiped off it with a new antimicrobial wipe. And I let it dry. As I let it dry, I've already verified what needle I have. I check with the MAR one more time to make sure I'm going to get the right dose. The right dosage that I need is 0.2 milliliters. So go ahead and prepare my syringe. Again, open it with the double K method. I'm going to take my syringe. I'm going to place it into my vial. First, I'm going to inject the air. Please omit that. I'm going to inject the air, going back 0.2 milliliters of air into my syringe. I have a 3 milliliter syringe here. I'll place my air, make sure it's above the solution. Once I do that, I'm going to go ahead and pull my solution, which is 0.2 milliliters. I'm going to invert the vial here. Alright, and I have 0.2 milliliters. Place it here. Alright, and place it on my clean surface. Now I'm going to prepare the patient. This is the patient's shoulder area. Okay, of course I've done my identifiers from the beginning. Now I'm going to get a new antimicrobial wipe. I'm going to start here in the center of where I'm going to puncture. And I'm just going to go in circular motions going outwards. After I do that, I let it dry. And after I allow that to dry, I'm going to go ahead and pull the skin, placing my hand in an anatomical position of where I'm going to place the needle with my non-dominant hand, which would be, I'm left-handed, so it would be this hand here. And I make starting at the chrominal process, lay my 3 fingers, then I open it into a V shape. And I take my needle, and I'm going to inject the medication at a 90-degree angle. So I'm just going to go straight into the skin, inserting at 10 seconds per milliliter. And I'm going to leave that medication, that needle in place for about 10 seconds. Making sure it didn't aspirate. Going to withdraw the needle, place my safety gauge on it, put it in a proper receptacle, puncture-proof receptacle, and then I'm going to apply pressure at that site on the patient. Just make sure there's no bleeding or to stop any bleeding for about 10 seconds with antimicrobial wipe. And after I do that and my patient is good, I'm gonna ask, if there's anything I can do for the patient, if there's anything need. I need to sit around, I think about a few minutes just to make sure there are no, well, I won't sit around. I will come back and check on the patient. But I make sure I do record the insulin that I gave the patient and the medication that I gave the Z-Track with. I'm going to make sure I record the time, date, my name, and how much I gave to the patient, and the tolerance, after how they tolerated it then, and then the tolerance after 30 minutes to the medication. I'll also, when I come back, I'll also do my evaluation to see has the insulin changed their glucose level. And that's about it. I'll wash my hands and leave the room. Thank you.